Mr. Conklin, the chair anxiously awaits the comment of the business gentleman from New Jersey.
Thank you, Mr. Chairman, members of the committee, Mr. Pasquarello. My name is Kelly Conklin, and I'm here to talk about health care and its impact on small business. I'd like to make one thing clear right up front. I'm not a policy expert on health care, but I deal with broken policy every day in my business. I own with my wife, Kit, as the Congressman said, our business in Bloomfield, New Jersey. And my purpose today is to give you a window into small companies like mine and how the mess that is our current healthcare system impacts us. I'll start with some background, try to explain where we are, and finally lay out a few ideas as to where we might go. A little history. My wife and I opened Foley Waite in 1978 in a 700-square-foot shop in Montclair, New Jersey. In 1987, we expanded and hired 4 employees, and we started offering health insurance. The premiums were about 5% of our payroll, and we paid it all. Today, we employ 13 people, occupy 12,000 square feet of loft space, and serve some of the most influential people in the world. And we fork over $6,000 a month in health insurance premiums. That's 20% of our payroll, one of the largest single expenses in our budget. Why do I still offer coverage? Practically, it's necessary to attract and retain skilled employees, but I do it because it's the right thing to do for my people. It's the responsible thing, too. If I didn't offer coverage, I'd just be shifting cost onto someone else. We've got to stop pretending that we can escape this cost. It's a fixed cost. When responsible employers offer coverage and others don't, it creates an unlevel playing field. If I'm contributing for my employees and a competitor isn't, they have an advantage. We'd be much better off in a system where all employers contribute to a reasonable amount instead of this game of cost shifting. That's why I support a system of shared responsibility where employers pitch in their fair share. April is a month I dread, but not for taxes. Taxes are simple. I call my accountant. But health insurance renewal is a nightmare. Rising costs force us to cap our contributions for employees, coverage, and we're switching carriers each year. We had Horizon Blue Cross Blue Shield, but they just raised our rates 25%, so we're switching to HealthNet. That means new primary care physicians, and for my wife, who has a chronic illness, a new doctor who knows nothing of her medical history. It's very frustrating as the person who writes and signs the checks every month to know that a lot of that money we spend isn't going to health and it isn't going to care. My shopping for health insurance, my choice, is who is the cheapest this year. 3 years, 3 insurance companies. And over the past 2 months, as we transition to our new carrier, our premium bills are now $8,700 per month. While I'm writing the check for the new company, I'm paying the full freight for the old company. This is efficiency. This is not bureaucratic. This is cost effective. Really? The health insurance market has failed to deliver on its promise for small business. It fails to contain costs, enhance efficiency, or improve outcomes. It fails to provide coverage to millions, our dry cleaners, our corner store owners, Joe the plumber, and Al the mechanic. Something has to be done. I think transparency is critical. It's time to have the insurance companies come clean and say up front what's covered and what's not. It's time to assure everyone access to affordable health care based on shared commitment where employers like me, our workers, health providers, and the government all pitch in. We can take a big step by creating a public health insurance option. A well-designed public health insurance plan would finally give small businesses like mine real bargaining power, provide a guaranteed backup, and introduce greater transparency. Most importantly, by creating genuine competition and restoring vitality to the market dynamic, innovation in the private sector will occur. I'm not against private insurance. I'm just saying we need more options. As a cabinet maker, my trade, I think about it like this. A toolbox holds a variety of tools, each perfected to perform a specific task. You can't drive nails with a screwdriver or cut wood with pliers. And in my experience, when a critical tool is missing, well, things can get ugly. With healthcare, we've tried to do everything with a hammer. The public plan option is a critical tool missing from the toolbox, the one that could stem rising costs. According to the Commonwealth Fund, reform with a public option would save employers $231 billion between 2010 and 2020, and $3 trillion for the nation. Without a public plan, we lose 3/4 of that. Billions for the little guy. Imagine what we could do with that. I've read about ideas I can't support. I don't think new tax credits are the solution to this problem. I would rather have real health reform that addresses costs than a tax credit that will only be consumed by skyrocketing premiums. We don't need to fiddle with taxes or jigger the tax code. We need policies to stabilize a health care system in critical condition. I know I'm not alone. I'm a member of the New Jersey Main Street Alliance, a coalition of over 300 New Jersey businesses working for health reform that works. In a survey referenced in my written testimony, small business owners said 3 things. 1, we're willing to contribute, but we can't go it alone. 73% said they would. 12% said they wouldn't. That's a 6-to-1 ratio. We support reform that includes the choice of a public health insurance plan, 59 to 26%, 2-to-1. We want government to play a stronger role in making health care work, 70 to 16%, 4-to-1. Small businesses are looking to you for leadership. We need you to enact health reform that works for us and our employees this year so we can do our part for economic recovery. Thank you, Mr. Chairman.